A nurse is examining a patient who has muscle pain and fatigue after working out. He determines that the patient has muscle strain. This is generally caused by which of the following? A. There is damage to ligamentous attachments. B. Excessive contraction causes tetany in the muscle body. C. Hypertrophy is causing swelling of the muscle fiber. D. The actin and myosin filaments have been pulled past their ability to overlap. The answer is D. The actin and myosin filaments have been pulled past their ability to overlap. Muscle strain is often caused by overstretching, during which actin and myosin heads are pulled to the extent that they are no longer overlapping, possibly to the point of causing tears in muscle tissue. Tears in ligaments are sprains, rather than strains. Which is the only muscle type that is non-striated? A. Skeletal muscle. B. Cardiac muscle. C. Smooth muscle. D. Voluntary. The answer is C. Smooth muscle. The only type of muscle that is not striated is smooth muscle. Smooth muscle does not use sarcomeres for contraction, rather, each muscle cell is a spindle that is covered in a mesh of contractile fibrils. These fibrils contract in unison when calcium enters the cell. Which of the following is the smallest unit of contractile tissue in cardiac and skeletal muscle cells? A. The sarcomere. B. Actin filaments. C. The myofibril. D. Myosin filament. The answer is A. The sarcomere. The smallest contractile unit in muscle tissue is the sarcomere. Myofibrils are made up of many sarcomeres attached end-to-end at a series of dark lines, hence the term striated, called Z-lines. Each sarcomere contains actin and myosin filaments, which pull together during contraction to shorten the sarcomere. The sliding filament theory of muscle contraction involves the dash attaching to dash and then pulling during the power stroke. A. Myosin. Tropomyosin. B. Myosin head. Actin. C. Actin head. Myosin. D. Troponin. Actin. The answer is B. Myosin head. Actin. The sliding filament theory of muscle contraction involves the myosin head attaching to actin and then pulling during the power stroke. Troponin is a protein attached to tropomyosin, a thin strand wrapping around the actin filament. When calcium enters the cell, troponin moves toward it, pulling the tropomyosin strand away from actin binding sites and allowing the myosin head to bind. Which of the following molecules binds to troponin during muscle contraction, triggering tropomyosin to move away from the actin binding sites and allowing the myosin head to form a cross bridge? A. ADP. B. ATP. C. Sodium. D. Calcium. The answer is D. Calcium. During a muscle cell action potential, calcium enters the cell via T-tubules, which are specialized invaginations of the sarcoplasmic reticulum. Calcium binds with troponin, which pulls the tropomyosin strand away from actin binding sites and allows myosin heads to bind. Neither sodium nor potassium bind to troponin, and ATP and ADP both bind to myosin, rather than troponin.